Yes.
Yes, thank you. Good afternoon, everyone, and welcome to this decision day. First of all, have we got any deputations?
No.
Thank you. If we move straight on to the first decision, which is residential and nursing care home new contract arrangements. Gail, are you going to take us through this?
Yeah, I'm going to start and I'll pass over to Denise as well. So yes, this is we're bringing the recommendation to you around a care home framework for our residential and nursing care. Just to set the context and the background for this, residential nursing care is an area of significant spend for us. We spend close to £260 million annually across older adults and younger adults services. And we're continuing to experience significantly high demand for these services, both long-term and short-term services. And we're experiencing increased complexity of need as well. At the moment, we're making around 80% of all of the placements that we require with the independent sector. And we're expecting that to grow with, as I say, significant increase in demand continuing. At the moment, we're purchasing all these placements on a case-by-case basis, on a spot basis. We don't have any sort of formal framework arrangement in place. And that means that it's time-consuming for us. It causes delays for residents, and it has significantly contributed to the increase in rates that we've been paying, which have been sort of rising by around 10% sort of year on year over the last couple of years. And it also means that we're managing many different providers. We're currently dealing with over 400 providers. So it's really been for some time our ambition to introduce a framework to allow us to work with a proportionate number of providers across the independent sector in Hampshire, but to ensure that we, deliver quality provision for our residents. And for us, it also potentially will mean more predictable rates. So we both know exactly what we're going to be paying for these care. So I'm going to hand over to Denise to share a little bit more about the recommendation.
Thank you, Gail. We believe that the care home framework will offer us a new opportunity to work with the wider market and the very large market, as Gail has identified, across Hampshire in a way that we've not been able to before. Just to be very clear that the 7.25 billion requested is in relation to a 10-year framework. That does not mean a 10-year contract. So the lifetime of the framework is for 10 years, and we would be able to call down a variety of contracts during that period. They could be for a short term or a long term. And by the inclusion of partner organisations on there, it means that we have a really positive opportunity to be able to collaborate in a way that we've not been able to before. As Gail has identified, there are a number of issues working with provider partners at the moment, and what we're aiming for is that market sustainability, the predictability, improved contract management, and to be able to support specialist services, which will lead to an improved quality of those services and better long-term outcomes for the residents of Hampshire, as well as for us as the County Council itself. To be able to collaborate between not just HCC partners, but also provider organisations in a new way enables us to meet our Care Act duties for individuals of Hampshire. We think that we've got an opportunity not only to stabilise the market, but to be able to better predict the needs of individuals and how we can meet those through the market. It also gives individuals and their families transparency in the process, and by using a really positive and wide-ranging communication strategy, we believe that we can support individuals or give information to individuals within Hampshire who are self-funders, who make up over 70% of the residential and nursing market, before they may need to come to us as the local authority for that support, enabling them to engage in the choice that we really haven't been able to support before. Thank you.
Can I just ask about this working, getting the ICS, if you like, to join forces with us in procurement? Presumably that means that the rate we pay will be standardised throughout the county in terms of we wouldn't have people outbidding us, paying more. Is that right, Gail, or not?
So I guess it depends on what we collaborate on. with the ICB. So Southampton City is looking potentially to call off their own contracts from this framework. So yes, they will have access to the same providers, and potentially we can, you know, get closer aligned on rates. With the Hampshire and Isle of Wight ICB, we'll be looking at specifically short-term services with them, where we are working closely together on discharge to assess services. So that should get us some sort of better, more manageable rates across the county. But the way we've structured the framework is that they may ask us to commission on their behalf, or they may draw down specifically themselves from the framework. So there is various ways that they might engage with this framework and with us.
Thank you. Graham, did you want to come in then? Sorry, I missed that.
Yeah, thank you, Councillor Fairhurst. So I just wanted to add, we had a very lengthy and really quite positive meeting last week with the opposition leads from HASC to go through both your decision on this care home framework and indeed Councillor Warwick's grants recommendations in a little while. I think it's fair to say that all three members, opposition members from HASC, were supportive. Their questions were really around the technicalities of the framework, i.e. it's a framework that other local authorities, for example, could look to use in future, but it doesn't mean that there's any risk to us as a consequence, because they would be contracting the services and paying for the services themselves. It's just an ability for them to make use of the framework. And the other comment was the size of the financial envelope, which again, for reasons that have already been explained, I think it's the largest procurement vehicle of its kind, probably as a local authority, we've brought forward. So 7 billion over 10 years is a very significant financial envelope within which to operate. That doesn't mean we're going to spend 7 billion over the next 10 years. Again, I just wanted to make that point. It's an up to, and it allows for others to make use of the same framework. Thank you.
Thank you, Graham. I must admit, I did a double take when I saw 7.25 billion, and you think, gosh. Dave, are you happy with that?
Sorry, just get my mic off of mute. Yeah, no, we've been through the report meticulously, and I'm happy with the report as it stands and the figures in the report. Yeah.
Jennifer.
I was just going to say that we have tweaked the recommendation very, very slightly in line with what Denise said about being clear that it's the framework that's for 10 years. So it's very, very slightly different in the decision record from the report. So Denise or Gail, I think you were going to actually read out the revised recommendation so that is has been said in this meeting.
I'm happy to do that now, if that's helpful.
Can we wait till we finish questions, Denise? Is that okay?
Absolutely.
Thanks. Councillor Warwick.
I've only just got one comment really, is that we're all very aware of the challenges facing adult social care, particularly in the elderly market right across the country, not just in Hampshire. So I think for our residents, it's so reassuring to have both value for money and quality of care is probably the most important thing. And I think that's what is ensured by this framework. So well done to you and the team. Thank you.
Right. Councillor Withers.
Thank you. No, I thoroughly endorse the framework. Makes common sense and probably should have happened a long time ago. The key issue for me is to make sure that Hampshire and Isle of Wight ICB do actually meet the criteria and work with us, as also Southampton, because it's critical that we all work together to ensure prevention, and then obviously any hospital care, and then the re-enablement respite, and the quality of the homes that we're talking about meet the future needs and complex needs of the ever-growing elderly adult population in Hampshire.
Thank you. Councillor Briggs.
Thank you, Chairman. No, I can only endorse what's been said. It's going to be an advantage to us, an advantage to our residents. I was just going to ask really, what of the homes you've been working with are they happy with it? Is it to their advantage as well?
I think if I take that one, yes, I think the answer is we've had a lot of engagement with the market actually right since the start of the year on this particular framework. And I think, yes, they all appreciate, well, they appreciate the fact that we have engaged them, we've taken their views on, they've had a chance to sort of influence how we work with them. And I think they are all looking for that predictability as well, in a sense of how we're going to work with them, their businesses, and give them good information and good insight on this decision making. So yes, they've been very involved with sort of looking at calling off a long-term resident nursing contract as the first one. And there's been lots of input from the providers themselves about the scope of those needs profiles, the sort of support and training we can provide to them to help them meet those complex needs, and giving them good information in advance to help with their business around potential rates and uplifts as well. So yes, they've got quite an appetite for it actually.
Thank you. It is advantageous to them, isn't it?
Yeah, yeah.
Thank you.
Thank you, Gail. Denise, do you want to, if there's no more questions and I can see no hands up, do you want to read out the revised recommendation?
Certainly will, thank you. So the decision is that the executive lead member for adult social care and public health approves spend of up to 7.25 billion under a 10-year care home framework commencing in 2024 to provide residential and nursing care as set out in the report.
Thank you, and I'm very happy to recommend. So thank you. I will now hand over to Councillor Warwick. Having said thank you to Gail and Denise, and if you want to stay,
thank you all.
Please stay, and if you don't, feel free to go.
I think we've got another officers meeting to get to. Thank you.
Thank you.
Well, thank you.
Bye.
Bye.
Right, Councillor Warwick.
Thank you so much, Councillor Fairhurst, and welcome to the continued D-Day. I'm Councillor Warwick, Executive Member for Younger Adults Health and Wellbeing, and this is the second paper, which is the Demand Management and Prevention Grants Award. And this is a very positive paper, and I'm going to hand over to Peter Stokes, who will outline who we will be awarding grants to this afternoon. Peter.
Thank you, Councillor Warwick. Within the decision report before you today is a recommendation to award 2 grants totalling £16,750 to cover 2 time periods between January 2024 and June 25 as part of the Local Solutions Fund. Now, the Local Solutions Fund, as you're aware, as we've regularly come to you, is designed to fund projects which over time are designed to reduce the demand seen on Hampshire County Council statutory services and support participants to live healthy, independent lives for as long as possible. Grants are awarded to projects operating in a specific location, so not county-wide, with one-off funding given. All local solutions applicants demonstrate how the project will be sustained in the long term beyond the life of the grant. In terms of the 2 grant awards we're seeking recommendation for award today, the first is also Minibus Community Volunteers who are seeking, who are recommending for a grant of £2,750 for between March of 24 and March 2025. This project is to deliver training to the Minibus Community Volunteers which serve also in its surrounding villages and rural area. This funding will enable residents who may have mobility or issues may not be able to access public transport due to its operation or due to other mobility issues, and it will enable them to be safe and supported to accessing provision in that local community, which will also help to reduce socialisation and loneliness for those people. We know that socialisation and loneliness is a big cause and a big risk factor for increased social care and provision. But by providing this grant, not only will it enable more volunteers to be trained, which will also help them increase their geographic reach and spread of the project in terms of being able to offer it to more people as well. The second grant is to Dementia Support Hampshire and Isle of Wight. A grant of £14,000 for a duration of between January 24 and June 2025. This project builds on other successful dementia support groups which have been successfully still up in districts of Winchester, Test Valley and New Forest. And this is looking to expand that same model to Eastleigh, where there's another recognised gap, having recognised that this is a project which we know can be sustained and is proven to have good outcomes. Not only does it provide support for the person with dementia, but it's also enabling the carer and the family members to get that other support they may need in caring for that person with dementia, their family member. So again, within this paper, all grants will be, in terms of the budget, come under the budget envelope of next year between 23-24 and also 24-25. And in terms of performance, all grants will be monitored by adults health and care officers, both for their making sure they deliver against those outcomes, but also evaluating their success, as has already happened in terms of dementia support. That's why we feel confident to expand it to another area. Obviously, as we talked about before, these are one-off grants. And not only do we have those conversations with them in terms of how they can be sustained beyond the life of the grant, but also they do sign a declaration within the grant agreement which states this is one-off funding and there's no commitment for further funding beyond that.
That's brilliant. Thank you so much, Peter. I think the importance you've just outlined there is that although these are relatively small amounts of money, they seed further activity and they're sustainable. So they're sort of one-off grants. And then we hope those organisations will be able to continue to grow and build on that. So that's really important. Councillor Fairhurst, do you have any particular comments to make?
Just a comment really on the Dementia Support Hampshire. I think, having seen firsthand the work they do with residents and the benefit it brings to not just the people with dementia but also the family carers, I thoroughly support this. And I think, you know, the more we can expand this sort of action to the neighbourhoods, the better.
Brilliant, thank you. And then we have Councillor Briggs and Councillor Withers, who are Chairman and Deputy Chairman of the HASC, the Health and Adult Social Care Committee. Have you got any comments? I know we give away quite a few grants and you're always very interested in them.
No, I think it's very important, as Councillor Fairhurst has said, that we cover both these areas. I know people live in the Aylesford area, and obviously dementia is a major factor now, and the variety of types of dementia is growing all the time, and any assistance we can give both to the individual and, as you said, their carers is very important. As Peter said, loneliness is a key factor that we must, you know, take cognizance of to ensure that we are providing these one-off grants to the elements in society that need them on an annual basis.
Brilliant, thank you. Councillor Briggs, is there anything you wish to add?
Only very briefly that I think especially the first one, it's going to help so many people, and it's so good that people volunteer to drive. So I think that's very important. And obviously the second one, it's dementia is such a huge problem that, you know, all the help we can give them. I'm glad now that people realise it's a one-off, that they're not going to be able to ask for next year. That's made very, very plain. So no, thoroughly endorse both of them. Thank you.
Thank you. Graham, you've got some comments to make.
Yeah, thank you, Councillor Warwick. Again, just for completeness, again, with the three opposition lead members last week, again, we went into detail in terms of a briefing. All three were content with the recommendation and the grant applications before you, and indeed that very discussion around dementia and sustainability from a one-off award was part of the conversation that we had with the three opposition leads. Thank you.
Brilliant, thank you so much. Peter, thank you so much for all your input, because I know you do a huge amount of work behind the scenes to bring these grants to this decision. So on that line, I'm very, very happy to approve the recommendation on this paper laid out on page 17. And that concludes our D-Day. So thank you so much to everyone for attending. Thank you.
David, can I have a quick word when everybody else is gone, please?
Is that telling us to get off the screen so you can have a quick word? We'll go.